right, welcome to The Explainer. Today, we're diving deep into a topic that's a classic for exams, visceral leishmaniasis. You probably know it as Kala Azar. We're going to build a high-yield, exam-ready guide to make sure you absolutely nail this one.
Okay, so picture this. This is a classic exam question, right? A young adult from Bihar shows up with a high-grade fever for 3 months. They've lost a ton of weight, and their spleen is massive. What's your top differential? I mean, this presentation just screams Kala Azar, and we're about to break down exactly why. So, here's our game plan for crushing this topic. We'll kick things off with what Kala Azar actually is. Then we'll get into the cause and the carrier, how the parasite invades, the key clinical signs you have to know, how to confirm your diagnosis, and finally, treatment and prevention. Let's do this.
All right, let's jump right into Section 1. What is Kala Azar? Let's define this thing, also known as the black fever.
Okay, so here's the deal. Visceral leishmaniasis is a systemic disease caused by a tiny protozoan parasite from the Leishmania genus. Now, the key phrase here, and you'll see this in exams, is obligatory intracellular protozoa. All that means is this little guy has to live inside our cells to survive. And it's not just any cell. It specifically goes after the reticuloendothelial system. Think of it as our body's defense and filtration headquarters, the spleen, the liver, and the bone marrow.
Okay, on to our next section, cause and carrier. Now, you know for any infectious disease, you've got to know two things, the culprit that causes the disease and its accomplice that spreads it. Let's identify them. So, who are the perps? The main causative agent is the Leishmania donovani complex. And how does it get around? Through the bite of an infected female sandfly. In India, that's specifically Phlebotomus argentips. And here's a super important point. Humans are the main reservoir here. Now, for your MCQs, you absolutely have to know the two forms of the parasite. Here's a killer mnemonic. Just remember PAM. P is for permastogote, which is the infective form that comes from the sandfly. A is for amastogote, which is the diagnostic form we find inside man. PAM. Got it? Good.
So, you might be wondering, how does this tiny, microscopic parasite cause such a huge, devastating illness? Well, let's follow its path of invasion. This is the parasite's master plan. It all starts with a sandfly bite. The fly injects the infective permastogotes right into your skin. Then, our own immune cells, the macrophages, come to the rescue, or so they think. They engulf the parasites. But here's the crazy part. Inside the macrophage, the parasite transforms into the amastogote form. It's like it's put on a disguise. Then it starts multiplying like mad, eventually bursting the macrophage open. And from there, the newly released amastogotes spread through the blood, ready to infect the spleen, liver, and bone marrow. It literally uses our own immune system as a Trojan horse to take over.
Now, what's really interesting here is how our body fights back, and this is a key concept. It's like a tale of two T cells. Your immune response can go one of two ways. If your T helper 1, or Th1 response kicks in, that's the good response. It activates your macrophages to actually kill the parasites and control the infection. But if your T helper 2, or Th2 response takes over, that's the bad response. It leads to this polyclonal B-cell activation, which causes hypergammaglobulinemia, and crucially, it allows the parasite to multiply unchecked. So the outcome of the infection literally depends on which side wins this internal battle.
Okay, so we've seen the battle happening inside the body. Let's move on to how that translates to what you'll actually see in a patient. Recognizing the classic clinical signs is your absolute first step to nailing the diagnosis. When it comes to your exams, you have to remember the classic pentat. That's right, there are 5 key features of visceral leishmaniasis that you just can't forget. And here's another fantastic mnemonic to lock this in. Feverish patients have puny hematology. Let's break it down. F is for fever, usually high grade, and it can have these weird double or triple daily peaks. P is for progressive weight loss. The next H is for hepatosplenomegaly. That massive spleen is the most consistent sign you'll see. The second P is for pancytopenia, meaning anemia, low white cells, low platelets. And the final H is for hypergammaglobulinemia, from that Th2 response we talked about. Feverish patients have puny hematology. Easy, right? So, you've seen the patient, you've got the clinical pentat in your head, and you're thinking, this has to be Kala Azar. That's a great start. But in medicine, suspicion isn't enough. We need to confirm it. So, how do we get that proof? All right, to find the parasite, we need a sample. Now, where do we get it from? The splenic aspirate is the most sensitive. We're talking over 98%, but it's risky. You could cause bleeding. So the most common specimen we use is a bone marrow aspiration. It's much safer and still gives you a really good sensitivity, around 80 to 85%. You can also use lymph nodes or even a buffy coat from blood, especially if the patient is co-infected with HIV. And hey, here's a mnemonic for the samples. Some brave lads bleed. Splenic, bone marrow, lymph node, blood.
Okay, this is absolutely crucial. Listen up. The gold standard for diagnosis, I'll say it again, the gold standard is the demonstration of Leishman-Donovan bodies, or LD bodies. You have to see the parasite. So what is an LD body? This is the perfect exam definition right here. It's the intracytoplasmic, non-flagellated, amastogote form of Leishmania that you see inside a macrophage on a Giemsa-stained smear. Basically, you're looking at a macrophage that's just stuffed full of those little amastogotes. You see that? Boom. Diagnosis confirmed. Now, seeing the parasite is the gold standard, but we have other tools in our toolkit. Serology, especially the rapid RK39 test, is super common. It's a quick and easy way to screen people out in the field. And then there's culture, using something called NNN medium. This isn't for a fast diagnosis, it's more for when you need to figure out the exact species of Leishmania or test for drug resistance. Okay, we've got our diagnosis confirmed. Let's wrap this up with the final critical pieces: treatment and prevention. How do we fight back against this parasite? Now, treatment is not a one-size-fits-all deal. It actually varies a lot depending on where you are in the world, and that's mostly because of drug resistance. So for the Indian subcontinent, and this is a high-yield point, the old drugs, the pentavalent antimonials, they just don't work anymore due to high resistance. The drug of choice, the one you need to remember, is liposomal amphotericin B. In other places, like East Africa or the Americas, they might use different combinations, but for India, it's liposomal amphotericin B. So how do we stop this thing from spreading in the first place? Well, prevention is a full-on assault from multiple angles. First, you've got vector control, spraying insecticides and using bed nets to stop the sandflies. Then there's personal protection, using insect repellents. But the big one, especially in India, is reservoir control. Since humans are the main reservoir, that means we have to find every single case and treat them completely. That's how you break the chain of transmission. It's a massive public health effort.
All right, we've covered a lot of ground, so here it is, your quick revision cheat sheet. Seriously, take a screenshot of this. It's got everything: the disease, the agent, the vector, the infective and diagnostic forms, our clinical mnemonic, the gold standard diagnosis, the key antigen for rapid tests, and the drug of choice in India. If you know everything on this slide, you are absolutely ready for any question on Kala Azar they can throw at you.
And that brings us to the big picture. Why does this matter beyond the exam hall? Because the fight against diseases like Kala Azar, this ancient black fever, is an ongoing battle. Drug resistance is a huge problem. Climate change is shifting where these sandflies live, so it leaves us with a really important question to think about. As the world changes, what new innovative strategies are we going to need to finally, and I mean finally, eliminate this disease for good?